Hi, I'm Katie, and I'm here to talk to new nursing interns about therapeutic temperature management in the emergency department setting. In this lecture, we'll discuss the basic principles of therapeutic temperature management, or TTM, identify the system that we use for TTM, identify exclusion and inclusion criteria for the initiation of TTM, demonstrate proper Arctic Sun cooling pad selection and placement, and then we'll discuss some potential complications or cases that would require modification to the cooling pad placement. And then we will follow up with the student actually going to a simulation lab, pulling out the pads and placing the pads on the patient, and describing different scenarios and what they would do as far as inclusion exclusion criteria. Some principles, basic principles of TTM. We want to protect the brain from the lack of perfusion secondary to cardiac arrest. Hypothermia actually decreases oxygen consumption by 6% for each degree in body temperature reduction. Now, the brain uses about 20% of the total body circulating oxygen, and brain injury is actually the #1 cause of death and debility post return of spontaneous circulation. A TTM has also been found to decrease cerebral blood volume and intracranial pressure. It's actually the only treatment that's been shown to reduce neurological disability post-return of spontaneous circulation as well. There are 4 phases, but for today, we're just going to briefly talk about the beginning of the induction phase. We want to initiate TTM as soon as the inclusion and exclusion criteria has been reviewed, and then maintain the mild hypothermia at 33 degrees Celsius for 24 hours. I'm not going to talk so much about that today, but that's the basic principle behind it. It is important that we document baseline level of consciousness as well as the neurological status of the patient, vital signs, cardiac rhythm, and a rectal temp. And of course, never delay getting the patient to the cath lab if reperfusion is an option. Okay. So let's talk about some advantages of the Arctic Sun. That's what we currently use at our facility to initiate TTM. It's very easy to apply. It's non-invasive. The pads, the way the pads are coated with the hydrogel and the water, the way the water goes through the high velocity water flow, it actually mimics water immersion. One thing that's unique as well is that these pads, you can fold them over on itself and it still functions as a cooling mechanism. For instance, if the patient has a chest tube in and you're putting the trunk pad on, and of course you can't put these on anywhere on broken down skin or on where there's any kind of evasive line, or it can pull it out. So you would just fold it over on itself and it can still work to do its job. And then for the case of the emergency room, we typically will use a temperature Foley probe. And so we'll have the Euro catheter in there. And then on a rare occasion, sometimes in the ICU, they'll use an esophageal thermometer. But the machine actually uses these temperature readings to adjust the water temperature. So really, we don't have to do much of the work. Alrighty, some inclusion criteria is that the patient needs to be intubated and comatose with the treatment initiated within 6 hours post-ROSC, and that includes if they're out of field and are out of the hospital and obtain ROSC. And then able to maintain a systolic blood pressure of 90 millimeters of mercury, and that can be with or without assistance like pressors. Exclusion criteria, they cannot have had major surgery within 2 weeks, a known systemic infection or suspected sepsis. If cardiac arrest is related to drug intoxication or trauma, that rules them out. If the patient's in a coma prior to arrest, if they have a positive pregnancy test. For our facility, we do not initiate TTM if they're less than 18 years of age, and of course if they have a DNR order. Some cooling pad and selection placement. So the Arctic Gel pads are actually located in trauma room 2 and cabinet 2 on the second shelf. We made all the 2s there to make it easy. You'll notice when you open the door to the cabinet that on the wall is a height and weight chart. You actually guesstimate the height and the weight on the patient to do your pad selection. And I've included the height and weight chart that you'll see is included in the packet with this information too. You'll notice that the pads actually come with 2 torsos and 2 thighs. And let me move me out of the way here a little bit. But you can see what we do when the pad placement is we don't put it over the spine. You'll start on the back, and you'll notice when we play with these in the simulation lab that when you pull off the backing, it's super sticky. So my recommendation, and we'll play with this a lot and you'll be able to figure it out, is to slowly peel the top corner here, place that on the back, and then slowly peel down and press it on the skin as you're peeling it down. If you peel the backing off all at once, it's a mess. It's horrible to have to deal with. And then you'll come around to the front. Now, if you pick pads that are too big, they'll go over on top of each other, which is fine. But if you pick pads that are too small, we do have a separate package called it's a large universal pad. And that large universal pad goes over the pads that are covering the trunk and kind of in the above the suprapubic area and above where the lower part of the pads hit for extra coverage. If the pads are too big, like I said, it doesn't matter. If they're too small, we want to go ahead and put that in there. Now, a lot of people ask, well, what's too big of a gap in between? We want to cover about 40% of the patient's body surface for optimal cooling. I usually tell everybody if you can put about a hand and a half, then you might want to consider using that large universal pad. Okay. Make sure that you put the date and the time on the pads. There is a white sticker on there for you to do that. Okay, some things to remember. We cannot place the pads over wounds, ulcers, rashes, any kind of invasive tubing. They are really sticky, and even though they're made to not tear the skin, somebody who's susceptible to skin breakdown, you have to be extra careful because you have to remember not only are you peeling something off of them, but you've changed the temperature of their skin as well, so they're going to be more prone. So you can, that case you would fold it over on top of itself. That hydrogel that's located on the back of the pad is non-allergenic, but it's also non-sterile and there's not antibiotic, it's non-microbial. A lot of people think that, oh, there's a rash, no big deal, I'll place it on top. It's non-microbial. You can still have skin issues and breakdown that might get missed and cause more problems. Whoops. You can fold the pad over on itself if the patient has invasive line. Please do not cut the pad. We've had people do that in the past. Water shoots out. It's a big mess, and then you have to replace the pad. If the inside of the pad gets soiled with urine or stool, be really careful to assess that, and you'll have to replace that pad. Now, if there's something on top of the pad, you can just clean it off with, I would do a rag with soap and water. Please don't use the microbial wipes on there that breaks down the padding. You can perform x-rays with the pads in place and actively cooling. And you also will place the pads over defibrillator pads, and yes, you can defibrillate while the Arctic sun is cooling, but by that point you might want to just go ahead and turn it off. Do not place over transdermal patches. We all should know that one. It changes the way that the medication is absorbed. Let's do some scenarios. We've got a 24-year-old female presenting the ER from home via EMS. Her husband found her not breathing. She was in full arrest. EMS was able to achieve ROSC en route. Per her spouse, she hasn't had any recent surgeries or illness. She does not drink or take drugs, and there wasn't any question about the scene per EMS. But what's something that you want to maybe exclude the patient, or something you want to investigate a little further that might exclude this patient from TTM? Actually, she's of childbearing age, so you would want to go ahead and do a pregnancy test. If you put the temperature Foley probe in and you find out through that she's pregnant, don't worry about it. You're not going to get in trouble for inserting the temperature Foley probe. I know they're a little more expensive, and we get on to y'all about that, but we're not going to worry about that at all. I'd rather you do that than put in a regular catheter and have to remove it to put another one in. So we've got a 72-year-old male who presented from local assisted living via EMS. Per staff, he had been on lethargic all day, hadn't been eating very well, and they thought that maybe he was running a temp. No recent traumas or surgeries. He codes in the hospital. We are able to obtain ROSC. What are some questions that might help us make a decision in regards to starting TTM for either assisted living or the family? Okay, and let's see. And ignore this lower part, sorry. Does he have a history of prostate issues? We see a lot of urosepsis, which would rule the patient out if he had a recent history of UTI or urosepsis. Another real important thing down here is he a DNR? You know, if he's a do not resuscitate, we wouldn't, of course, start TTM at that time. We've done this in the past and had to discontinue it. Now, let's say he meets inclusion criteria and you guesstimate his weight around 60 kilograms, skinny, and he's about 5'7". If you'll refer to your height and weight chart, what size cooling pads do you think he would require? So if you look at that, he's kind of right at the edge of a small and a medium. As we talked to before, go ahead and size up and go ahead and put a medium on him. Okay, and like I said, we'll get to play with this in the patient simulation, and we'll have different scenarios in that as well. All right, the human brain's amazing. It functions 24 hours for 365 days, functions right from the time we're born, and only stops when we take exams. Any questions? All right, thank you for your time. I hope you learned something.